Hello to all my support fibromyalgia friends. Welcome to a live broadcast. Today, I'm going to be doing an ACR Convergence conference recap. Now, I meant to jump on earlier, but I caught wind that there was a patient perspective workshop that was going and taking place live. So I waited to that. I watched that. I supported the patients that were presenting, and I'm including it in my presentation today. So I hope everyone is having a wonderful Sunday. I am not ready for Monday. If anyone knows how to get ready for Monday, please let me know because I could really appreciate it right now. I've been spending my day at the conference, at the ACR Convergence conference with my good friends, Kelly from More Than Lupus. Thank you so much for allowing me to join the booth and be a part of such an amazing conversation and conference. And then, of course, we are also joined at the booth by my colleagues Estella and Juana from Looms for Lupus. So we're at the booth. We're going to be there for a couple more days. So if you are attending the ACR conference, stop by our booth and say hello. We would love to talk to you. There is a feature where you can interact through Zoom, and we can talk to you actually face to face through Zoom. At least we're not there in person just yet, but we can interact with you just as well virtually. So if you are attending the conference, please do stop by. But I did want to give a recap for anyone that wasn't able to attend the conference this year and sort of engage you in a different way to create more patient engagement and understanding what goes on at these conferences. So I am Melissa Tolar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. I am having a lot of fun trying to rack up those points at the ACR conference as well, and even bringing and talking about health coaching and how that relates to the conversations, and understand if the rheumatology providers have integrated health coaching it all into their initiatives, because health coaching applies to a lot of variety of illnesses and diseases. And I know that Cleveland Clinic is present, and they did a lot of research in health coaching for functional medicine as well, for group health coaching, especially with chronic pain and rheumatic conditions, autoimmune conditions. So it's exciting to see all that's available at ACR. A lot of the conversations are geared with autoimmune conditions, rheumatic diseases. I'm learning so much about different aspects of arthritis and lupus, and even other conditions. And then also they're talking a lot about COVID-19. So I've been sitting in a lot of those panels and trying to just tweet out the information, trying to share the information as best as possible. If there is something that you want to learn more about, please don't hesitate to reach out. And for this talk in particular, I'm going to gear it towards more of the fibromyalgia information. So I compiled some of the information for you today, and we're going to take a look at what's getting presented about fibromyalgia. I think I'm going to have to do multiple videos to break things down, because I did include the patient's perspectives today and replace some of the other material that I'll have to come back to when it comes to what's being presented at ACR this year regarding fibromyalgia. And fibromyalgia overlaps with so many other conditions, and so it's integrated into other presentations as well. But I heard today on pollution and how it affects rheumatic diseases. Again, there's a lot of conversations on COVID-19, autoimmune conditions, rheumatic diseases. There's a discussion going on right now about Lyme disease, and they were doing a lot of case studies. So I'm really interested in seeing more of those case studies. But let's get into the presentation of what I was able to kind of recap. And again, if there's something that you see that you want to hear more of, I can dial it in from these poster presentations and try to present the information as best as I can. With the background that I have, I'm still going through a lot of material because the conference begins really early. I'm on Pacific time. So looking at the times, it could be like 4:30 a.m. Pacific time for me. So I'm playing catch up as we go along this weekend. And I've been sitting at the computer watching some of the videos, catching up, making sure to support the advocates out there doing such amazing work and support the researchers too. So it's just a lot of material to go through. So I'm going to do the best that I can to give you some of the interesting material that I've been seeing. So again, welcome everyone to all of my Support Fibromyalgia friends. This is all recap from the ACR Convergence conference that's taking place right now. If you are on social media, you can follow the hashtag ACR21. And especially there's a lot of activity going on Twitter. So if you are a user of Twitter, you can search for that hashtag and there's a lot of conversations going on. Follow some great, amazing people. I'll add them in the description because shout out to Carrie from My Several Worlds. She's been tweeting out and posting from her time zone. I know she's doing the same and catching up with all of the material. We have only so much energy to give to sometimes these conferences and trying to join as many panels as we can so we can get the information to the patients community and all of you out there, because we know that not everyone is able to attend these conferences. So we're going to try to break down the information that we can share with you. So here's part of I'm going to break down some of the abstracts that we're seeing. So there were some great abstracts presented on fibromyalgia and clinical pain. I'm still going through some of the videos right now, so I'm going to take apart 2 of them here. I'll probably have to do a separate video just from Dr. Mark Martel because he went into medical cannabis and some of the content I know on social media gets blocked. So I'll probably have to just do one and only video on that just in case, because I don't know what these restrictions are. But you can see these abstracts and presentations. So there is a video available of the presenters and you're watching live. You can talk and ask questions of our presenters. So some of this breaking down the correlation of fibromyalgia survey, questionnaire, and quantitative sensory testing among patients with active rheumatoid arthritis. There was a Q&A presentation, and then quantitative analysis of gender and racial disparities in randomized controlled trials of fibromyalgia, which we're going to get into a little bit in more detail because it's an important discussion to have regarding what's taking place right now with how we conduct research, how we were conducting research for fibromyalgia. So that's a really good topic that I want to open up more and have a discussion about. And then there's factors associated with pain reduction and improved well-being among fibromyalgia patients using medical cannabis. So I'm going to do a completely separate video on that because sometimes that type of information gets blocked in social media. So I don't want the entire presentation to get blocked. So I will come back with more information on that. And then Tonics, actually, the Chief Medical Officer, Dr. Gregory Sullivan, presented on that information. We've been hearing a lot from Tonics Pharmaceuticals for a while. So they did present some from their relief study. So we'll go into a little bit more detail with that. So it was good to see that he was part of the presentation as well. And then there were poster sessions about fibromyalgia. So I'll definitely have to go into a separate video to go into this because I haven't gone through everything. You can see some of the green check marks. That was my way of telling myself that I've gone through the information here, but you can see stuff on sleep, which I want to dial into. Moods. I'm trying to understand the overlap with rheumatoid arthritis better. So I'm going to be reaching out to my other friends. And I do invite anyone out there who's an advocate that wants to talk about other conditions because overlapping conditions with fibromyalgia is super important. And we need to work together and share information. And that's what I've noticed, that we need to do a better job as a community of coming together, of understanding what each other goes through, similarities, and how we can effectively work as a community across all chronic illness conditions. And then, of course, we're seeing some group behavioral activation. Many of you, and I'll dial this in another presentation, was from Swing Therapeutics. We have a video with Steph and Jeremy that you can go check out, learn more about CBT and digital therapeutics because they've presented with us. So there was a presentation there. So clinical impact of a digital behavioral therapy for fibromyalgia management, a randomized control trial. So they're going into some of the details of where they've evolved at Swing Therapeutics, and now they're opening up enrollment, which we've shared before, and we'll be sure to share the link again. So definitely check out that video that we had with Swing Therapeutics. I'm still going through the reductions of pain, and again, this CBT, chronic musculoskeletal pain effectiveness, and interleukins. Of course, we're diving in, and I want to know about patients in South India. So I dialed that in a little bit. So I'm going to have to go into some of the details of those poster sessions and kind of summarize it for you the best that I can. One of the highlights was Dr. Daib and just the quantitative analysis of gender and racial disparities in randomized controlled trials of fibromyalgia. I was really happy to see such a discussion take place because I think I've been talking to some researchers lately on the diversity of who's been submitting for the surveys, and there is a lack of diversity. Let's just say that, and it brings up a whole conversation on what's been happening when surveys are collected or surveys are put out there in newsletters and we're getting information from fibromyalgia patients. Are we doing the best we can to reach everyone? And there's a lot of technological barriers. There's a lot of information of like access. And this comes up, there's a whole deep conversation. I would love to have this conversation and continue having this conversation with other advocates that are more well versed because I'm learning, I'm going, and I'm trying to understand the science too and what was put together or not occurred when all this research is taking place. So as we transfer that and move forward, what have we missed? What have we missed with racial disparities and health equity that we've completely ignored from this point? And like now we're giving information to fibromyalgia patients. So we really have to examine this much more closely. And there was one poster too on Googling rheumatic conditions, and fibromyalgia was included. So the lack of information, and they're driving it obviously to well known websites, but there was still a need to have an improvement of information and all this data collection too. So, who were we including in all of this information when we were doing all these studies? So, just the background of this particular study was fibromyalgia is a chronic pain syndrome characterized by widespread musculoskeletal pain. So this is stuff we know. Mainstay treatments include tricyclical antidepressants, selective SSRIs, reuptake inhibitors, epileptic drugs. So the purpose of this study was to examine whether or not gender and racial disparities exist in the context of research subjects recruited for clinical studies performed on the only three FDA-approved medications for fibromyalgia. So thank you to Dr. Daib for jumping into this and highlighting it and now creating an even bigger discussion that we definitely need to have. So again, I encourage other fibromyalgia advocates out there, if you're much more well-versed or have this type of experience, or you're actually doing some research right now, get in touch. Let's have a roundtable discussion. Let's expand on this discussion because we need to make sure that racial disparities, we need to talk about this. We need to talk about health equity much more within the fibromyalgia community. And I liked how we included the gender disparities too, and a lot of what we've assumed. And he addresses this with men, even with the ratio being 3 to 1 back then when this was taking place. And you'll see from the figures how much was not necessarily taken into consideration with gender and racial disparities. So, kind of the conclusion for this, and I'm going to share the abstract so you can go read the abstract and dial in. And pay attention to the figures because even in figure 1, statistically significant overrepresentation of Caucasian or white research subjects in comparison to all other ethnic groups as determined by paired t-tests were shown. You can see the pie charts, you can see the difference with who was involved with these trials. And definitely you'll dial into some of those figures, but the conclusion was evidence of widespread gender and racial disparities among subjects recruited for clinical trials of various pharmacological agents for fibromyalgia do exist. So, whereas female prominence for fibromyalgia is believed to reflect a true gender I can't even speak. So looks like the gender was pretty matched up, supposedly, right? Supposedly. But more research is definitely needed to determine whether or not racial disparities observed indeed reflect on the nature of the disease. So yes, let's just open up that conversation and do more with what we have and can do more and have these conversations as we go forward. Because we need to include diverse populations. As someone who's filled out surveys in the past and trying to figure out, back in the days, I think we have definitely evolved survey systems to include, different genders, different races, but back when I was filling out applications related to fibromyalgia and surveys, I honestly didn't know what to include as another. Having multi-racial background and, 3 different ones, how do I even include that? Do I just pick one? And some of the surveys actually, when you fill it out, you're only allowed to pick one. And for me, that was such a confusing conversation to have. I'm like, do I pick like being Indian? Do I pick being Hispanic? Do I pick being indigenous? So it's like, how does this correlate to how surveys were set up, especially for the fibromyalgia community, and then what we were not including? So I'm finding this just a fascinating topic. And I wanted to just give a quick shout out to Crystal. Hello, Crystal. And Eileen, hello, welcome. You definitely, yes, please watch later. This it's always it'll always be like recorded and there unless I accidentally delete it. But I'm trying to get better at these live videos. So we're gonna just kind of go through some of what's left for the presentations. And there's a lot more to share. So I encourage you to watch as your body and permits, as you can. Chime in now. Let me know where you're tuning in from. Please like and share the videos. And so one of the presentations that they did do was Dr. Gregory Sullivan from Tonics. So this is speaking of the information that we've been hearing a lot, right? So the TNX 102SL, cyclobenzaprine, HCl sublingual tablets. So this was about targeting improvement in sleep quality in order to reverse the central sensitization. So we've kind of heard conversations of this with their different patterns of relief. I think you've read some blogs maybe from Fed Up with Fatigue or Pain News Network, understanding what is happening with tonics. And it's kind of been a back and forth, and I need to dig in a little bit and get myself completely updated. So prior studies of TNX at a 2.8 milligram dose in fibromyalgia showed signals for broad efficacy, but narrowly originally missed significance on primary outcomes of daily diary pain reduction. So here we're going to have an interesting conversation of the improvement of sleep, but maybe not necessarily seeing the reduction of pain right away. Although I will say, I think they only did this for maybe like 14 weeks. So it'd be interesting to see an extended period of time if we're seeing more pain reduction as we get an improvement in sleep, because many of us have that unrefreshed sleep with fibromyalgia. Are we getting the deep sleep? So measuring that is going to be kind of tricky. So in this presentation, this is part of the phase 3 trial, their relief trial, where they evaluated the efficacy and safety of TNX for fibromyalgia at twice the dose, so 5.6 milligrams. Now, I find it interesting with the delivery of medication. So sublingual tablet is fascinating, but it'll also get into your system a lot faster. But it might be good for fibromyalgia patients, especially if you have GI disruption, because sometimes when you're, the oral supplements or the oral medications with a GI issues may not get readily absorbed. So sublingual is actually a great and interesting delivery system. So TNX 102 SL is a sublingual tablet formulation of cyclobenzaprine hydrochloride. And these brand names for it include things like Flexeril, if you're familiar with that, Amtrix, and Fexmed. And it's a muscle relaxant and antidepressant that's being evaluated as a daily bedtime treatment for fibromyalgia. And the goal is to see if TNX 102 SL helps fibromyalgia patients sleep better. In addition to fibromyalgia, TNX 102 SL is also being considered as a treatment for post-traumatic stress disorder, PTSD, alcohol use disorder, and agitation in Alzheimer's disease. So I'll have to look up more information in it related to Alzheimer's disease. I will share some of the abstracts so you can go and look at the links, and also some of the clinical trials, because I did read up that Rally was enrolling. So I think when I went over to the clinicaltrials.gov, Rally has finished enrollment, but it is active. So that's the other phase. And I'm trying to understand where they exactly were at with that. I've been following for a long time, then I dropped out, and I know there was updated information this past year. I was trying to read up on some of that information, I think, of what was happening, and they were going to move forward with this. So I still need to catch up. So if anyone out there is already caught up, please share in the comments for what you know or even your experiences. Have you taken Flixeril before, or were you part of any of this clinical trials or volunteered for it, or have more information for us? So part of the conclusion was that the bedtime TNX at the 5.6 milligram dose significantly reduced daily pain, provided a larger rate of more than 30% pain responders. So it showed activity in improving sleep, fatigue, and other fibromyalgia symptoms and measures of function. So I think this is something that is of interest to us, right? All of us want to get better sleep, want reduction in pain. So please definitely take a moment to look at those abstracts, and I'll include the links in the description for you to go take a look. And I'll include some other information as well as we start to dial in and learn more about this and get all our updates from what's happening with tonics. Now, I switched up my presentation last minute because I wanted to share the patient's perspectives, which happened at noon today. And I was really excited because I'm inspired, right? I want all of you out there, if you're interested in getting involved in like patient advocacy, or you want to do, you don't want people to go through those same hurdles that you went through, and you're trying to figure out how to support the community, please, just get dialed into some of these patient perspectives. And there was a lot shared on social media. There's a lot of ways you can get involved. So that's why I thought it'd be important to share some of these patient perspectives with you. And for Noriko sharing what she did to create a support group in Japan, and also just learning from all of the other advocates out there was really incredible and super inspiring. So I sat in on her presentation and just what she had to do to get more awareness of rheumatic conditions overseas and internationally, and created a whole support group system that she grew and created education around. It was very insightful. And then we got to meet Natasha, who I was blown away at what she has achieved at, I think she's only 18 years old. So Natasha, shout out to you. I am so impressed and very grateful too for the younger generation and what they're producing when it comes to just filling the community need for everybody out there, so that they have a support group system, they have the education that they need, they have the resources that they need to tap into systems that we kind of forget about. And I have a special place in my heart for this because I was managing fibromyalgia as a teenager from 14 years old and trying to tap into those resources when I was that age. You're like using dial up AOL and trying to find the communities. I mean, most of the time you had to go somewhere physically, which was really difficult. So I love the fact that we can take advantage of social media and use these tools to connect with each other. So it was great to see what Natasha is working on at Take a Pain Check. So Take a Pain Check mission is to provide youth impacted with rheumatic diseases and other chronic diseases with a wide variety of perspectives and experiences. It is a platform that raises awareness about support groups, resources available for children and young adults living with arthritis and other chronic illnesses. The mission is to empower youth with challenges to advocate for themselves. And we'll be sure to include a link and tag in social media for her. Then we had Guadalupe, very inspiring, of the breakdown of translation of information and trying to just be understood in a community. So this is, and how she turned her experience to like advocate for other people, especially in the Latinx community. So her presentation was Fighting for the Care We Deserve: My Experience as a Latina Patient Researcher During the COVID-19 Pandemic. Very inspiring of her journey and breaking down barriers and creating resources for the Latinx community so that they can benefit from all of the information that was going on during this and with chronic illnesses across the board. So really appreciate her presentation and got inspired by her work. Then there was something that I was like, I didn't even know about. It was Creaky Kitchen. So Creaky Joints, I follow them in social media. And how in the world did I miss Creaky Kitchen? So We'll definitely include a link so you can join them. These virtual presentations of cooking, cooking together, building a sense of community, learning from each other on different recipes. So Chantelle presented on how the online cooking show, how she built it, building a community, encouraging better food choices for herself and others living with rheumatic and chronic diseases. I love it. So the person talks about nutrition. I didn't even know this was going on. So these are resources that you can tap into as patient communities and also get inspired and learn from other patient advocates out there, because it's super important that we connect and just help each other with and build a better community for each other. So I thought it was just important to get these patient perspectives added to the presentation today. Because again, I know what it feels like to face adversity and feel alone, and trying to find people that are like you. Because even volunteering as a fibromyalgia advocate in the early 2000s, I was having trouble finding people my age and a lot of the support group systems. And again, I didn't have social media necessarily as a resource. But then as I started to dive into more things from MySpace, I got into that and created the first kind of MySpace hub for fibromyalgia as I volunteered as an advocate. So it's definitely incredible, and that's the things that we want to create over here at Support Fibromyalgia Network. Really expand on our resources, give back to all of you out there. So don't hesitate to reach out to me. I am Melissa Toller. I'm the executive director of the Support Fibromyalgia Network, and you can find our social media accounts on YouTube, Facebook, Instagram, Twitter, and LinkedIn. And we are definitely here to support you. And please do use me as a resource. I love including people. I love talking and sharing information. And if you love science, we can throw down some science terminology all day long. But I want you involved, and I want you to get involved. And conferences like this, I'm noticing maybe what some of the other groups are doing. And I think it's important that we do the same for fibromyalgia. So bringing you into the fold if you're interested. I'm planning for next year. Thank you so much to Kelly at More Than Lupus for including me in this and allowing me to experience. It's been a while since I've been to ACR, been a long while. So I kind of missed out because of the placement of fibromyalgia, and then even starting the organization, there's definitely been some barriers. So that's what we kind of want to do here with even the patient community. And I love that patients are being more included. I would love to see more health coaches included at ACR as well. And in just a collaborative care, holistic care. So I'm looking for those conversations, but I like the conversations that I've heard so far, and we want to expand on it more for you. So how can we include the patients even more in these types of conferences? Let's figure it out. Let's create solutions for all of you, and then share the information so you can be more involved. So thank you, everyone. There'll be more recaps coming up. I have a lot more information to share. There's a lot of posters to go through that I've been fascinated by. May not specifically relate to fibromyalgia, but I love the way that they're studying how we can use technology, telehealth, how we use our resources effectively, group behavioral health, more on community health, which is something I'm very fascinated about. So more to come for sure. Stay tuned. Thank you, everyone, for tuning in. Please like and share the videos. Keep coming back because we're going to have more live streams. I've outlined more topics for you, but if you have something that you would like to have a video on, or just a topic you're more interested in, or if you are a researcher out there or a patient advocate that wants to come on board and do an interview, I would love to have you present to our Support Fibromyalgia friends, especially for our researchers. We have the new researchers in action. So we are showcasing researchers out there. So anyone that presented at ACR today, please get in touch. We would love to do an interview with you. So thank you again, everyone. I will see you next time. Bye.